Hi, I'm doctorarjaybe here, and I wanted to talk about health insurance. Okay, so, you know, this is not the greatest subject for me to talk about as a physician because it's almost like the health insurance is working against the doctor. Um, uh, Years ago, when I was still practicing, we got to the point where we were just kind of like breaking even. And my concern was, that, it might be in the future that we might even be at a loss. So I talked to my office manager at that time and I said, I think it's time for us to raise our rates. Her comment to me was, you can raise your rates as high as you want. You're not going to get any extra money. And I said, why is that? And she said that they pay you the same amount regardless of what you charge. It's not based on your charges, it's based on, what they're going to willing to pay for the patient visit. My comment to her at that point was, how can a physician do business when you got a insurer that's limiting the amount of money that you can make? I think most physicians would agree with me that the system is not fair. We are controlled in how much money we're able to make, and there's really no other industry that is controlled so much as we are. If I was a lawyer, I could charge whatever I wanted to, whatever I felt that I was worth. Since I've been to lawyers in the past, they can charge sometimes $100, for a 15 minutes or $100 an hour, whatever it is. And if you give them a call and you spend 2 to 3 minutes on the phone, even though it's not an hour, it's $100. So their visits are hours. $100 an hour, kind of like a minimum. And even if you only spend a few minutes, that's considered an hour for them. Their system is great. They go ahead and they charge whatever they want, and they're going to tell you this is what you owe, and you don't really have anything to say about it. If you want to go to the lawyer, you pay it, Plus, they have a retainer, I have to pay, when I was going to a lawyer, I had to pay $2,000 retainer in addition. And what does a retainer pay for? Not much, So, they got a great system. Unfortunately, we had a system similar to that, but we kind of messed it for ourselves. One of the things that the lawyer can do is to refer a client to another lawyer, and they get a kickback. So they will get like 25% of the fee that the second lawyer sees. And this is felt to be the referral fee. Now, we used to have referral fees in the old days. And then not the lawyers, but the surgeons decided they didn't like paying 25%. So they started complaining, and now we have a law that says that if I receive money from the surgeon, I'm in violation of a federal law. Another thing that the doctors used to do was they would own labs or stock in labs, and they would get money when the patients went to the labs. Yeah, another law says now I'm not allowed to own a lab, or if I do own a lab, I'm not allowed to charge my own patients for any labs that they do. So it's kind of like they're doing whatever they can to limit a doctor's income. And then the insurances come around and they say, we're going to pay you $60 for a visit. Now, if you figure out your overhead and your overhead comes to $65 a visit, too bad, because all you're getting is $60, So this situation is not too fair for the physician. Now, I guess it may be good for the patients because the costs are being limited and that means they're not going to charge you as much. But I've also been a patient, and I can tell you that it's not so fair for patients either. I had a insurance just recently that had, I think it's a $1,000 or $2,000 deductible, and then they were only going to pay 80% in addition. So I had 20% of the bill plus the $1,000 or $2,000 deductible. It was ridiculous. It was really almost like having no insurance sometimes. So in any event, I think that the insurance industry is all about money, and that's all it is about. I say that because I remember a patient of mine who had a stroke, and I wanted to get an MRI scan to evaluate the brain and see what damage had been done to the brain. And I ordered that, and then they denied it. I said, I want to talk to the medical director. I talked to the medical director and I explained what was going on with this patient. She was having symptoms of a stroke. I wanted to see how much damage was going on. He said to me, well, I don't think we can approve that. And I said, what are you talking about? You're a physician yourself. You know that what we have to do when a person has a stroke. How can you possibly deny this patient from having the test? The doctor, who is the medical director, says to me, oh, I'm not telling you how to practice, Dr. Bruno. I'm just telling you what we're going to pay for. So, you got to understand that that's what insurance is all about. Insurance is about making money. And if you think that the insurance is, thinking about your benefit, you should think again, because it really isn't. Insurance on the stock market is one of the best stocks to own. They pay dividends. I mean, they hardly ever, have to worry about going bankrupt. But whatever. That's the way life is. So you got to accept what life is. You can't argue sometimes.